real risk is going to come a couple of months from now if you see the continued spread in West Africa that we've seen at the current pace. What's likely to happen is you'll reach a tipping point where you're going to get migration out of that region, and you're going to see clusters of infection simultaneously crop up in major metropolitan cities around the world.
America is awash in innuendo, bad guesses, and half-truths at a level not seen since everyone was trying to figure out when and if George Clooney would ever get married. This time, however, the stakes are perhaps dangerously high. The Ebola patient in Dallas has gone critical. There are reports of people being detained in airports. The CDC may wind up in major transportation centers. And Americans still feel as if they are being led down a dark path at every governmental comment. So let's seek some truth and factual answers about this disease and what the future holds. Let's welcome to MidPoint the Chief Medical Officer for Tenet, Florida Physician Services, Dr. Edward Anim-Addo, joins us today in studio. Dr. Addo, thank you so much for being here today.
Thank you. Pleasure to be here.
When you hear and see what is being talked about, the different news reports, the media, the internet, are we indeed just completely covered right now in so much innuendo and so much fear that it's almost impossible to find out what the facts really are?
I don't think we are necessarily. There's clearly evident public concern about this, and rightly so, but it's certainly not apocalyptic, and some of the news reporting has been fairly hyperbolic. And what we need to do certainly is to look at what the facts really are for this particular situation here in the United States. We have one index case in Dallas that traveled on a commercial jetliner to the United States from a region that actually, up until the reported epidemic last year, had never actually seen a case of any of these hemorrhagic fevers, Ebola or otherwise. These are countries that were emerging from decades of civil strife and wars and have no functioning public health systems. It's an entirely different situation from what we have here in the United States, with the CDC, with the public health systems, the state, and also the World Health Organization declaring a public health emergency of international concern. It certainly heightens the awareness and raises this to a different level in relation to how our response ought to be to it.
Is it almost dangerous, though? Some of the hyperbolic nature that you're out there, the fear-mongering, I hate to use that phrase, but it certainly is out there these days, about Ebola crossing the border, about Ebola being spread through the air. There seems to be a screaming that's going on right now at a lot of media outlets, which is driving people to not know the facts of what's involved here. Isn't that part of the distrust that the American public's now involved in?
Well, clearly, yes. I think that's part of the distrust. And one thing needs to be emphasized. Ebola is not a contagion. Ebola is not spread by airborne droplets or fomites or respiratory secretions. Ebola is spread by close personal contact. And because of that, that's why the impact on healthcare workers in Guinea and in Sierra Leone and Liberia has been so devastating.
Because they don't have what we have here.
Exactly, because even personal protective equipment was a challenge in the initial stages of this epidemic to actually procure for these poor individuals who are the front lines of taking care of these patients. Consequently, because of their close contact with droplets and fluids, urine, saliva, vomit, and blood secretions from the airways, and also from the GI tract, these individuals were exposed to massive amounts of infective virus and consequently came down with infection. And that's what's sad about it, because what's tragic is that you have the individuals who actually have awareness of this disease, and those individuals in those populations that can actually do something about it are actually those who are being wiped out.
I have about 30 seconds, then we'll take a break, come back and talk more. But do you understand why, and can you at least understand why people don't trust the CDC with the tremendous amount of bad information and the bad news and outbreaks and things that we've had? Understand that.
Yes, I do understand that, but we have to put this in context. And you know, this is actually interesting, because it's not the first time actually that Ebola has been reported in the United States. In fact, in 1989, there were monkeys in Virginia and in Pennsylvania who actually were reported to have Ebola virus. There were no human outbreaks. In 1990, there were lab technicians in the Virginia area who actually tested antibody positive to Ebola, but did not have obvious disease. Now, this was a different variant of Ebola. This was the Reston virus. But
I'm going to ask you to hold that for one second here, because we have to take a break, come back, because I want to follow up on that a little bit more, if you will. After the break, the facts on a possible treatment, and what about a cure, along with what needs to be done at American airports and other ports of entry. It's coming up right here on MidPoint.